Hi, my name is Chandler, and I'm a second-year Master's of Athletic Training student at OSU. I decided to do research on the effectiveness of biceps tenodesis surgical intervention in treating SLAP labral tears in active duty military members. Some background information includes shoulder injuries are common in athletic populations, especially in overhead athletes. One of the reasons the shoulder might be at risk of increased injury could be due to the joint's multifunctionality and anatomical structures, therefore decreasing its stability. Considering this, there is one subgroup of athletic populations that is often overlooked where athletes are concerned, and that is the military. Military members go through extensive physical training, therefore putting their bodies at risk of suffering substantial injuries. In 2016, one clinical review looked at the prevalence of superior labrum anterior to posterior labral tears, otherwise known as SLAP tears, in military members. The study mentioned how service members have a higher chance of suffering a SLAP labral tear compared to non-military members. Currently, it is undecided whether SLAP labral tears are best fixed by arthroscopic repair or by biceps tenodesis with the additional labral repair. The purpose of this study is to determine if the biceps tenodesis surgical intervention is effective at improving pain and patient-reported outcomes in active duty service members. For the methods, I did my literature review search from October to November of 2024. The databases that I used include PubMed, EBSCOhost, and Embase. For the inclusion criteria, I used studies that are peer-reviewed in the English language, published in the last 10 years, included at least one patient-reported outcome measure, and were equal to or higher than a 4 on the CEBM scale. Exclusion criteria included limited to studies including participants between 18 and 45 years of age, and limited to studies including active duty military members as participants. After my search was complete, I was left with 4 studies, all of which indicated that biceps tenodesis as a SLAP labral tear repair was effective. The evidence suggests that biceps tenodesis as a surgical intervention is an effective treatment option for SLAP tears among active duty military members. Patients in all studies found improvement in outcomes related to return to unrestricted active duty status, VAS scores, ASES scores, SANE scores, and range of motion. This allows patients to have another surgical option for SLAP repairs. Overall, biceps tenodesis surgical intervention improves patients' overall function and pain, aiding in their ability to return to work. It is important to note that one limitation of these studies is the lack of female participants, so future research should be done including female military members.